Hello, dear students. How are you? I hope you all are doing good and it is very cold outside. But since it is a cold, it's a winter season, but we have to learn. We have to do our daily work, right? So today I am here with the same energy and with proactiveness with a topic which is another important topic of mental health nursing, and it is very important. Okay, guess what? Yes, that is nothing but principles of mental health nursing. Okay, when we talk about principles of mental health nursing, it is everyone has their own basic needs. Yes, and principles are generally for physically ill or mentally ill patients, whomsoever it is. The way we give care to them, the way we treat them, should encodes with a principle, right? And it has an intrinsic worth and dignity. Intrinsic worth means the self-worth and dignity. The patient also expect that the healthcare providers treat them with dignity, with respect. Yes? Okay. And it has a potentiality to grow. It has a potentiality to grow. It means physiologically, psychologically, the patient will grow, the patient will develop positivity, the patient will develop a goodness in the emotional well-being, and also principles are very much required for us to develop professionally. Okay, right? And we'll get into the topic. So, there are 12 important principles of mental health nursing. Among that, now we are going to see about 5 important mental health nursing principles. It means first 5, right? And the next forthcoming video, we can see about the rest of the principles of mental health nursing. Okay, shall we move into it? Okay. Right. The first principle is accept the patient as he is. Right. So it is when we see the patient without a judgment, without thinking any secondary thought, we need to accept the patient. Right, how the patient is. Maybe physically the patient is not well, mentally the patient is not well, not looking well, and shabbily dressed, or very aggressive, showing a violent behavior, however it may be, but we need to accept the patient as it is. Okay, so it is conveying the feeling that it is loved and cared. We are loving you and we are caring you, but at the same time we need to maintain our boundaries. Boundary limitation is very important for the healthcare provider. Okay, right. And be non-judgmental, right? I have told already. So we should not judge the patient or punish the patient. If the patient is not showing a favorable nature of behavior, we should not punish or we should not judge the patient. Accept the patient as he or she is. Okay, show interest in the patient as a person. First of all, do not provoke or show ourselves that is, I am a healthcare provider, I am a nurse, I'll come, I'll treat you, I'll care for you, I'll give medication, I'll say the procedures, and I will complete and I'll go. No. First, think about that you are a person. So, make the patient feel that a nurse is also a person, a human being, right? She's showing the interest in the patient as a person. Okay, do not think that he is a psychologically unwell person. You just think that he is a person, I am also a person. So, person to person, how we are going to maintain our professional relationship, right? Okay. Next, recognize and reflect on feelings which a patient may express. See, the points which I am saying, all these are coming under first principle. Okay? Yes. Recognize and reflect on feelings which a patient may express. So, patient is expressing anger, violent nature of behavior. First, recognize why the patient is angry. What is the reason behind that? What is making him to behave in such a way which is not favorable to the situation? Okay. Okay, next, talk with a purpose. Yes, when we are going to meet the patient, go with a goal. When we are meeting a patient, say hi, hello, how are you, did you had your breakfast, have you got a good sleep yesterday? Yes, now we can start with our medications. Okay, you please cooperate with me and I'll say what is this medication and what is the purpose of it. Okay, so this is the purpose. So whenever we are talking, it should not fill with vacuum. कुछ मैटर ही नहीं है उसमें. No, not like that. There must be a purpose, there must be a goal set up, then we should talk with the patient. So that patient also may feel that, acha, this nurse is coming and talking very to the point, and also the points are very clear, right? Okay. I hope you are following me and it is clear to you. Yes? See, if any doubt you have, any points to be get clarified, do comment it and ask your question. I also have joined my mail ID so that you can post your question through the mail also. I will revert it back within 24 hours, right? Okay. Next, important process is listening. Give the feeling to the patient that there is someone who is listening us, who is giving importance to us. I am having problem. I am having low feeling. I am not confident enough. I want to share it with someone. So that someone will be a healthcare provider, maybe a nurse, maybe a psychiatrist, right? So when he or she is sharing with the nurse, listen carefully, listen with interest. Okay, right? It means a listening must be an active process, not a passive process. Yes. So second principle is use self-understanding as a therapeutic tool. We have seen already in our previous videos what is therapeutic communication is. Yes. So communication within a treatment process, right? With the goal of a treatment process is a therapeutic communication. Now that therapeutic communication has an important tool known as self-understanding. So it means we need to understand ourselves first. Yes, we need to understand ourselves first. Then we understand the patient. This also described in a video. Characteristics of therapeutic communication, empathy. That plays a role in this principle. Using a self-understanding of oneself and the other. Other means the patient. Right? Then we can identify and recognize what problem the patient is going on and how we can help in overcoming that gradually. Okay? Right. Next, use consistent behavior to increase patient's emotional security. Consistent behavior. The way we behave to the patient must be consistent. Today, if you are talking with a patient in a normal sense, the next day also we need to maintain the same pace. Right, we are free from work today, so we are speaking to the patient well. The next day we are having too many patients, so no time to talk with the patient and we are rushing with our work. No, not like that. Use the consistent behavior to increase patient's emotional security. Okay, so if you are maintaining the consistent behavior, patient will accept us as a healthcare provider. Yes, this nurse is coming and doing the work for goodness of me, for my well-being, for my growth in physical and mental health, right? This sense of feeling we need to bring it. So this kind of secure emotional security we need to bring it. So emotional security, how it will come? Through the consistent behavior to the patient. Okay, right. And the fourth principle is give reassurance to the patient in subtle and acceptable manner. Reassurance. Dear patient, do not worry. I understand your problem. Yes, I understand your problem. You are passing through the tough phases, tough stages, right? This will go away. But for this, what you have to do? You have to take your medications properly. I'm not saying this within a week it will be cured. No, it's not like that. It will take months and years together. You need to be on medications. You should not skip on the medications. If you are continuously taking medication and coming for the proper follow-up, you can see good improvement in your health. This is known as assurance, a right assurance. Okay, false assurance means you take the medications, everything will be okay, everything will ठीक हो जाएगा, right? No, not like that. So giving an assurance in an acceptable way, whatever is possible, only that we have to say to the patient. If patient has many doubts, how many thing we can clarify it, we can do it. If not, we can say that all your doubts will be clarified by the psychiatrist when he is coming for the rounds. That also we can say for making the patient satisfied and giving a good method of reassurance. Okay, right. And the fifth principle is, guess what? Okay, changing patient's behavior through emotional experience and not by rational interpretation. Okay, so it means patient's behavior will change by emotional experience. The patient should experience, yeah, day one I was very sick. Yes, it means the patient should slowly gain the insight. That insight development will take time. Yes, the first day the patient may be very arrogant, violent, showing very disruptive behavior. But after a week taking medications and having a good communication with the healthcare team members, healthcare providers, the patient may slowly bring changes in his behavior. Okay, so this is by the emotional experience. The patient should feel that yes, all these people are doing goodness for me. That emotional experience patient should feel, not by the rational interpretation. You take this medication, this will become normal. You undergo this therapy, this will become normal. No. Okay, only is by emotional experience. The patient should feel emotionally. Right? Yes. So these all are the 5 important principles which we have seen. Okay, let us summarize one by one the principles. Okay, say it along with me, right? Okay, what is the first principle? Accepting the patient as he is, right? Without having any judgmental thought or without having a secondary thought, we are accepting the patient as he is or as she is, right? And second principle is using self-understanding as a therapeutic tool. The principle 2 is using a self-understanding as a therapeutic tool. Next, using consistent behavior to increase the patient's emotional security. Using the consistent behavior to increase the patient's emotional security. And giving reassurance to the patient in a subtle and acceptable manner. And the fifth principle is changing patient's behavior through emotional experience and not by rational interpretation. Yes? Okay, by this, today's topic is getting completed here. I wish you all go through the video completely. Wherever you have doubts, you just note it down in the comment section so that the doubts will be clarified. I am once again saying there is a mail ID also. You drop your question in that mail ID, that will be answered within 24 hours. I'll try to answer within 24 hours. Okay? So till that, signing off. Tata, take care, and we'll meet in the next video very soon. Okay? Bye.